Well, Dr. Bensianoff, I think you do in your practice also orthodontic work. Is that correct?
Oh, absolutely. We do all kinds of different orthodontics.
What does all kinds of different orthodontic mean? Tell me.
Well, we do regular braces as well as clear braces as well as Invisalign, which is the most popular braces on the market where you can't really see them.
I see. So I've heard about the Invisaligns, of course, and I think those Invisaligns are kind of like, almost like a mouth guard, like a tray. You stick it up, and there are 10, 20 of them. They're computer pre-made, and like every 4 to 5 weeks or whatever it may be, you change to a new one, and it keeps slowly adjusting your teeth. And it's rather comfortable. But are they really invisible? Tell me, are they really invisible?
Yes, they're not. They're very, very. You can't really see them because they look like bleaching trays that we use. They're made out of clear plastic, and you do have to change them every 2 weeks. The results are great, especially if you have little crowding in the front, your teeth are a little crooked in the front. It works great for adults because it's very easy. You can take them out and clean them and put it back in. Also, the treatment doesn't last very long. Usually within 6 months to a year, we can accomplish great results. As well as they're not visible. That's, if you're not a dentist, I guarantee you won't be able to see that the person has the Invisalign trays on.
Wow. So, especially for the adults, not that like teenagers are not self-conscious also, but they're like at least more used to that there's a certain time where, one wears braces, kind of. But for adults, that may be a little more sometimes, Jesus, I have to now wear braces and I'm 30 years old and I have this job at the bank. So you're telling me a bank teller, if I go and cash my money with him, and not that I ever have any to cash, but anyway, so I wouldn't see that he wears braces. Or if I'm a bank teller, I wouldn't, my client in front, my customer would not necessarily see that I wear braces.
No, you would not.
Beautiful. Now, I heard about another very big advantage of the Invisalign, and not to such bullshit, but it seems to be making orthodontics more pleasant, apparently, right? I mean, already, if you don't see it, that alone, I guess, is the whole idea, and it does make it pleasant. Even though you did tell me, and we're going to get to in another section, that the regular braces, the ceramic or the clear braces, that they're even making a fashion statement with them these days. You can put little footballs on it, little hearts, and then it's just apparently, kids love it. But back to the Invisalign, especially for the slightly more adults, you take the trays out when you eat. Is that true?
That is correct. You pretty much have to wear them most of the time. When you sleep, when you walk around, when you work. You only take them out when you eat, drink something hot, or brush your teeth. The rest of the time they have to stay in.
Right, and that's the key. That's the beautiful thing, I think, versus, let's just say, the traditional braces, which would include the clear braces and the ceramic braces, which is maybe the same. Because you have the wire, that doesn't come out. So the spinach, spinach flag keeps hanging there. And very obviously, I've heard from many orthodontics or people who do orthodontics work like you that children, anybody for that much, who get the braces, if they're not very, very dedicated in brushing their teeth, they might sometimes walk away with a bigger. They got their teeth straightened out, but now they have periodontal disease. If they don't take care of it. I mean, if they do take care of it, obviously that's not the case. But if you can take it out, brush, obviously then there's much less of a chance to get that periodontal disease while having orthodontic work. Would that be true?
Not only periodontal disease, but you can develop a lot of cavities as well. Once the braces come off, a lot of times, especially with regular braces, and the problem with kids is not a very good compliance. you get a lot of cavities that need to be fixed. Patients need root canals after they get their ortho treatment done, versus Invisalign, where you can safely take them out and put them back in. It's a lot less of an issue because oral hygiene is improved by a lot.
Mm-hmm. Right. And so what about the person who is at the beginning, while he maybe hasn't noticed yet that other people don't see it, is a little self-conscious? So let's say he, within the first few weeks or months of wearing the braces, when he's still a little self-conscious, let's say he has that first very important date or that job interview. Would it be devastating for him to take it out for that 1 or 2 hours and then put him back in it? As long as he doesn't overdo it and do it too often?
No, not at all. I mean, you can remove the braces for an hour. That's not an issue. Those clear trays, or they call them the aligners, and put them back in an hour. That's not even an issue.
Okay. Now,
1 hour.
In terms of coming to the dentist, since you get the braces, does the patient get all the trays with him and he just keeps packing them in and never has to come to you anymore? Or does he still have to come every month or 2 months and gets checked and gets his braces? How does that work?
Well, they still need to come in to make sure that there's a good progress. I still need to keep my eye on it, but the appointments are not very long. And sometimes it depends on the treatment, but sometimes they have to come in every 6 months, sometimes every 4. So they still need to see me, but the appointments are short and not very invasive.
Okay. Now, at the big, in Invisalign, so you can take the braces out. So that, of course, somehow opens the door a little bit, especially with, I guess, teenagers who could be, they're eating lunch in school and they're getting all carried away by teasing that girl across or the boy across the table, and bang, they walk away, maybe even step on that aligner, and it breaks or gets lost. What then?
That's not even a problem, because we can call the Invisalign and they'll send us a new one at no cost.
I see. So losing one here and there and or breaking it for whatever reason, there's no extra cost to it. They just send it again.
That is correct. That's another beauty of Invisalign, where even if you lose it or you break it, they guarantee you, and there's a warranty on the trays, on the aligners, where we just need to call them and they'll send us the new ones.
Okay. And it doesn't inhibit, stop, prolong the treatment unnecessarily long. It goes rather fast.
No, it does not. Within a week, you'll have a new aligner.
Got it. And so you said at the beginning that with the Invisalign, if Invisalign is the proper treatment, because sometimes if the mouth is way too bad, an Invisalign might not do the job. But you would be able to determine that once the patient is in your office, right?
That is correct.
And so as long as an Invisalign is on it, the treatment is as fast or faster than with normal braces. Is that what you said, or did I get that wrong?
Well, usually because with regular braces we can fix bigger problems. That's why it takes longer. But on the average, Invisalign treatment is within 6 months to a year.
I see.
So, yes, versus the regular braces, it takes shorter time. But to determine whether a patient is candidate for regular braces versus Invisalign, they need to come in and have an evaluation done.
All right. And have you noticed that there is a big trend in, I have heard there is, I don't know if that's true, that more and more adults, instead of like doing 6, 7, 8 veneers, which, right away goes in the thousands and thousands of dollars, and of course means cutting down your teeth and doing all kinds of things, that they actually go and do Invisalign braces instead?
Oh, absolutely. It's all about being conservative. If you get too invasive, then there's more complications. Doing Invisalign is a lot more conservative than doing veneers, because you have to shave your teeth down, and it works to a great. It works really well. But you also have to know that you need to wear your retainers, just like with regular braces.
Right. So it's a little bit of a trade-off with a veneer. With veneers, you probably be done in a visit or two. Costs probably 2-3 times as much, and more importantly, maybe you to a degree damaging your teeth, which then down the road could fail, and because of it might need an implant, because you grinded them, and the teeth a year or two later may say, that's it, I give up, they tried to kill me, might as well go. Which will not happen with if you straighten them out. So if your teeth basically are in good shape and they're not too bad, only misaligned, then or orthodontics, and especially Invisalign, is a good option to go, and more adults are availing themselves of that thing, of adult orthodontics, right?
Oh, absolutely. Especially these days, when patients present to my office with the misaligned teeth but healthy teeth, a lot of times, even with veneers, you cannot accomplish as great of the results as with the Invisalign.
Mm-hmm. Beautiful.
And you don't have to damage your healthy teeth.
Mm-hmm. Great. Well, again, very informative, Dr. Bensianoff. Thank you very much.
You're welcome.